Thank you for that wonderful, warm welcome. You all jumped out of your seats. I thought you were leaving. Thank you so very much. And to Ashim Ramuni, thank you for that wonderful introduction. You read it just the way I wrote it, and I'm grateful. I'm grateful for the wonderful hospitality. And give him a round of applause, President of the Board. Well done. And to Don Kelso and all the other luminaries who are here. I know that Indiana State Medical Association has been also represented here, as has our administration. So it's great to be with you all, and I'm really grateful to have a chance to be at the 12th Annual Indiana Public Policy Forum for the Indiana Rural Health Association. Health has been much on our minds here in the Hoosier State, and you all are people that are at the tip of the spear. Across the street there at the State House, we talk about policies that will impact the health of Hoosiers, but you all are out there making it happen every day, making it a reality every day. And let me just say that I truly believe there is no state in America that has a more dedicated group of men and women working in healthcare than in the state of Indiana. So thank you all very much. 35 critical access hospitals, 16 rural hospitals. You make a difference every day in the lives of our communities and in the lives of our families. And as your governor, I'm grateful for that. And on behalf of all the people of Indiana, just thank you for the incalculable contribution and difference that you make. You're also major employers. I want you to know that I'm very aware of that. Major employers in the communities that you serve, and so it's a particular joy for me to be with all of you today and just share a few thoughts about some of the policies that we're advancing. I understand Dr. John Werner was over a little bit earlier, and hope he did a pretty good job. He's a very shy and retiring man. Some of you may have known him from his days at the Indiana State, but thank you for the eye roll there. Whoa. I'm just so excited to have Dr. Werner, the first doctor to lead the Family and Social Services Agency of the state of Indiana. He's just doing a phenomenal job. So thanks for welcoming him today. You know, I said not long ago that other than public safety, the state of Indiana has no higher priority than the health and well-being of our people. When I applied for this job, we said we're going to make job creation job one, and we have. I'm very grateful, as was just recounted by the progress that Hoosiers have made on the job front, including employers in this room. We've seen unemployment in our state drop from over 8% to 5.7% today. 100,000 net new jobs in the last 2 years have come into communities, large and small, in the state of Indiana, so we're making great progress. Those are specific goals. When I applied for this job a couple of years ago, was to increase private sector employment and to increase investment in our traditional areas of strength. We also focused on education, and I've been pleased to see our graduation rates going up, our test scores are going up, and to see the policy innovations that we've been advancing and will continue to advance in this session of the General Assembly. But if you go back and look at the roadmap for Indiana that I applied for this job on, healthcare was at the very center of the goals that we established, because for reasons that you all know much better than me, we've got work to do on improving the health of Hoosiers and encouraging Hoosiers to take greater ownership of their own healthcare futures. And I want to talk to you a little bit about that today, a little bit about policies that we're advancing, and also to ask, obviously, for your full partnership in taking on some of those challenges. But thank you again for the wonderful hospitality today and for the difference that you all make. First and foremost, Mrs. Pence joined our State Department of Health Commissioner Jerome Adams just last week to launch an initiative that I hope has made its way to all of the healthcare providers represented here, and that is the Labor of Love campaign. It's part of a public information campaign that is really designed to confront the scourge of infant mortality in the state of Indiana. Just to give you a couple of numbers, from a statewide perspective, infant mortality rate is about 6.7 deaths per thousand. In 2011, that infant mortality rate was 7.7. But Indiana ranks, however you reckon it, in the bottom 10 states in the country in the heartbreak of infant mortality. I don't much go for percentages. I wasn't that strong on math in grade school. But when you sum that up to roughly 600 infants die every year in the state of Indiana before their first birthday, it starts to take on high relief. I'll just never forget, it took Karen and me quite a while to get our family started for unexplainable reasons. We were in that category of unexplained infertility during our first 5 years of marriage. And you all have dealt with patients, maybe some of you have dealt with that in your own families. And when our son finally came along, who's now 23, and now beginning a career in the military, my greatest fear was that he wouldn't see his first birthday. It really was. That we had gone through so much heartbreak as a family, month in and a month out, with the heartbreak of the disappointment of not being able to see our family started. That I'll never forget. I was preoccupied with that, and so when I look at a number like this in infant mortality, to me it just goes straight up into my heart, and I just think of 600 broken hearts in the state of Indiana, and what a moral obligation we have in this state to confront that, to deal with that. And as your governor, we have made this a health priority for the state of Indiana, and we are going to reduce infant mortality with your help. Mrs. Pence helped outline that public information campaign last week. We all know that the primary causes for infant mortality, complications that occur during pregnancy or low birth weight, birth defects, and of course the sudden infant death syndrome. But the Labor of Love campaign, which if you haven't looked at it yet, we've launched a television ad campaign, an online campaign, and social media campaign that's going to go on through the end of the year. And it's an effort to connect expectant mothers and new parents with fresh resources. We specifically are focusing on early and regular prenatal care, safe sleep practices, which as you look at this statistically, and we actually, as the state of Indiana, we actually established, probably many of you in your operations have a central data hub in your organization. Most large and complex organizations do. We actually last year became the first state government to establish a single node data center hub. We call it the Management Performance Hub in the state of Indiana. We worked with international data firm SAP to set up the system. It's in the basement right underneath my office, and it's looks like the bridge of the Enterprise for any of you Trekkies in the room. It's really a pretty cool place. But the first project we took on was data analytics. We commissioned a group of data scientists to look at the data coming in from all different sources in the state of Indiana to really analyze where we could put resources on point to confront or support efforts to confront infant mortality in the state of Indiana. And we came up with a number of these initiatives, and they're informing the legislative process in this session. We're going to be resourcing institutions like yours with kind of proven programs based on that data analytics that we did. But again, some of the things that came out were the role of breastfeeding, the role of safe sleep practices, but it just all seemed to, avoiding tobacco, drugs, and alcohol before, during, and after pregnancy was a factor. The importance of early and regular prenatal care just could not be overstated. And so looking for ways, and we'll be looking to this association to give us some guidance about ways that we can better resource our hospitals in the city and on the farm to assist and support early and regular prenatal care will be critical to it. But the ad campaign, we just would really encourage you all in your communities, do what you can kind of leverage the investment the state of Indiana is making on the Labor of Love campaign, and really spread the word. My hope is that whether it's the 211 phone number that people can call if they think they might be pregnant, or if they are pregnant, just to find out what resources are available, what counseling is available. We really want to be a full partner with you in making new resources available to our expectant mothers in the state of Indiana. I ask for your support specifically today in a Labor of Love campaign. I think the website might be laboroflove.com or .gov or something, but so somebody can Google it if you lose interest in the rest of my speech and tell everybody later. So, second thing I want to mention to you as well has to do with an education effort. You know, in addition to being there and making a difference in the health and well-being of people in the communities that everyone in this organization serves so well every day, you're also employers. And we set our state on a course a couple of years ago to making career and technical and vocational education a priority in every Indiana high school again. And this is very fresh, it's very new. I will tell you, I was talking to a national thought leader over the weekend who was actually fascinated with this, because you may have seen that the administration in Washington last week came out with a proposal about community colleges. And most of the time when people are talking about career and technical education, they're talking about post-secondary. And I think Indiana might be the only state in the union that's talking about bringing it back to high school. And the way we're doing that also is very different. And that is that we're, what we want to do, and we're going to put real resources behind this in this session of the General Assembly, is we want to use the work of the last 2 years through our regional works councils. And we want to craft curriculum on a regional basis in our high schools that will give young boys and girls the opportunity to get the background, the training, maybe even earn an industry recognized certification to be able to walk out the door of high school and maybe apply for a job in a great local employer. And I recognize people in this room represent in many cases the largest employer in your community. And so what I'm asking you, my first ask was on infant mortality, if you're taking notes. All right, full partner. You can just spread the word, all right, and help us in this legislative process. Number two is work with us in helping to craft healthcare career pathways in your local schools. And just be ready that after this session of the General Assembly, there's going to be all new resources to repurpose and refocus what's called, I'm kind of uncoachable, you know, I always call it career and vocational education because I've just kind of stuck in the word vocational. But they'll know it as CTE at the high school. It's career technical education. But tell them, if you haven't done it yet, I'd really encourage you to do it. Say, you know, I saw the governor at our conference, and he talked about this thing that they're doing, and our hospital would really like to be directly involved with the local school to see if we can create a classroom or a series of courses that will put people in a position to come in and fill the entry-level positions that are available in your hospitals today. Okay? I know in Greensburg, I don't know if Greensburg's represented in the room, but there you go. You guys are already doing this with, it's nurses assistants, or it's kind of the entry-level under a nurse's assistant that Greensburg are already doing it. There's communities around the state that are already doing this organically. What I'm saying to you is there's more help on the way. There's more resources on the way. And so go from here. If you bump into a legislator before the end of business, tell them, Mike's got a great idea on that career technical education thing. Really, you got to be supportive of that. And number two, but really, the legislation that put this into motion 2 years ago passed unanimously, which if you're new to the legislative process, that doesn't happen a lot. But so there's enormous bipartisan support for what we're seeking to do here. But more importantly than that, I think we'll get the resources. I really want you to go home and start right now and reach out to the local school and say, hey, here's what we need. Because I guarantee you that there are young people in your community who would like to go right to work after high school, would love to work at the hospital right after high school, but don't necessarily have any background in that. Maybe their family isn't involved in any health care. Maybe they're intimidated by the environment. They don't know that there's good paying entry-level positions that are available there. And I really want to encourage you to engage on that. I'm very passionate about this. I come from a family. My grandfather immigrated to this country. He came through Ellis Island. He drove a bus for 40 years. I worked in a gas station, helped pay my way through college, and I just was raised to believe all honest work is honorable, right? And I think our high schools ought to work just as well for our kids that want to go get a job as kids that want to immediately go get a degree. And the second reason I'm passionate about this is because I believe that success begets success. That young person who ends up in a program, I'm not going to pick on Greensburg, but they're really doing it right in a lot of ways here, so I'll single you out just for fun. That young person that ends up in a course pathway, they take a couple of courses, they get some exposure to the local hospital, and then they may say, well, all I really want to do is work at the hospital and get a job there. Then they start to find out, maybe I'll go get a nursing degree. That'd be great. Maybe I'll get a college degree and I'll become a nurse. And then maybe they find out even more about themselves and say, gosh, now I've got a great career as a nurse, and now maybe I want to go to the next level as a nurse. Maybe I want to go to medical school. I really think that if you allow more young people to start where they want to start in life, you give them the tools and the background and training to start where they want to start, they're going to discover more things about themselves. And they're going to have a better shot at achieving a more prosperous and a more fulfilling future for themselves. And obviously from an employer standpoint, I hope I'm right in your strike zone on this, right? Because you all are trying to fill those positions with competent and capable people, not just today, not just filling today, but what I'm talking about is creating career pathways in our high school so that as you're making long-term plans, as our rural hospitals are making long-term plans for growth in your community, that workforce is going to be a part of, okay, well, we've got a full partnership with the high schools in this community for healthcare careers. And so when we make a decision about maybe expanding in this way, adding a clinic over here, we know there's going to be young people coming up with God-given abilities that maybe feel a calling to be involved in the healing and the caregiving process who find a place to do that in our communities. Very exciting to me. So anyway, say something positive to a legislator if you bump into them, but more importantly, go home and just reach out. Reach out to your local schools, reach out to our workforce development folks locally and say, I heard Mike about this, and how do we get involved? How do we as an employer in this community in the next 12 months get involved and make sure that there's that background and that training? Lastly, let me speak to the Healthy Indiana Plan. Actually, I want you to know that we've really been working our hearts out on this, and I couldn't be more grateful for the Rural Health Association and the healthcare provider support that we've had. I think the full partnership with our healthcare provider community in the state of Indiana was seminal to our ability to make the proposal that we made to the administration in Washington, D.C. I would tell you we're not there yet. But I would just tell you that, I tried to make this clear in my State of the State address the other night. That is, we've really been working our heart out on this. I'll never forget when I went down to Evansville because the president flew into Evansville on National Manufacturing Day last fall. So we got the call from the White House that said, does the governor want to greet the president's coming to town? Well, I'm kind of old school. The president's probably about as liberal as I am conservative, but I worked with him when I was in Washington, and I respect the presidency, and I said, you bet, I'd be happy to be down and to greet the president. This is his first trip to Indiana since I became governor. And so I went down, but I also said, well, this might be a nice opportunity to talk to him about the Healthy Indiana Plan, right? And so I called up their office and I asked for a meeting. I said, we're going to be at the Evansville airport. Why don't we, if I could have 15 minutes, I'd just like to tell them what the status of our negotiation was. We submitted our waiver in July, on July 1st. And this was, I'm going to say this was maybe October that it came in, maybe September. And so the White House actually called me up and said, well, we're obviously not able to have a meeting. But one of his assistants said to me, Governor, he's getting off the plane. I mean, if you want to talk to him on the tarmac, he'll talk to you. And I said, okay, done. And so you can probably Google the picture. There were some pretty memorable shots. We just had a very engaged discussion. I think some national newspapers called it animated. I don't remember it being particularly animated, but I did say to the president, I said, look, we've got a proposal in front of you that is different than what any other state is doing on Medicaid reform. because ours is not an idea, it's a program. And it's a program that we've been implementing for the last 6 years in the state of Indiana. And it's consumer-driven healthcare. It empowers people in the Medicaid population to take greater ownership of their own healthcare. And it's been incredibly successful. I mean, those of you that have dealt with people in the Healthy Indiana Plan program know what I'm talking about. 95% of the people enrolled in the plan said they would re-enroll if given the opportunity to do so. And this requires people who are just getting started out in life and on the first rung of the economic ladder to make a monthly payment on a regular basis. There's consequences if they don't. Okay, there's incentives for them to engage in wellness and better healthcare choices. I mean, it's all built on the idea of personal responsibility being at the center of healthcare reform, and we've been proving that it works. That's our slogan for the state: is we're the state that works. And in Indiana, our Healthy Indiana Plan works. That's why I said I had no interest in expanding traditional Medicaid. I see, for reasons I don't have to tell healthcare providers, Medicaid is a bureaucratic system. It's fraught with all kinds of challenges, there's some recent studies done that found that people that walked into hospitals with Medicaid coverage versus people that had no Medicaid coverage, I think it was out in Oregon, that there was actually no difference in healthcare outcomes for people that had no coverage versus people that had coverage. Well, that's not a sign of a program that's working. Well, our program is working. And the health outcomes in terms of reducing inappropriate utilization of emergency rooms has been tremendously encouraging. And so when I met with the president, I made that point. I said, well, first off, I want you to know this is not a proposal; it's a program, and it's a program that we're proposing to expand to more Hoosiers. He acknowledged that fact and understood that this was something Indiana had been doing. But then the second thing I said, and this is something, I was in the House Republican leadership when the president was elected, and served in that capacity. I was the third-ranking Republican in the House at the time, so I was in a lot of meetings in the West Wing, and the president and I developed a very cordial professional relationship. So I looked at him there on the tarmac, and I said, one other thing I'd really like to tell you. And he said, yeah, go ahead. And I said, I'm really serious about wanting to do this. And I said, this is, and he said, and I said, I want you to know, this is not politics. I think this would be in the interest of the people of Indiana. And frankly, I think it could be a model for the country. And we'd really like your administration to greenlight. His administration had approved the current Healthy Indiana Plan twice already as a waiver. And I said, I really like the opportunity to build on this very successful model. And I said, I just want you to know from my heart, this is something that we really want to do. And he said to me, Mike, I've seen the proposal, and it's very clear to me. This is a very serious offer on Indiana's part. And he said, we're looking at it from that framework. So, what I would report to all of you is those discussions are ongoing, literally week by week. We're in regular staff level discussions, and I've continued to be directly involved. And I made it clear in my State of the State address last week what our parameters are. I don't think Medicaid is a program that we should expand, traditional Medicaid. But I think it's a program that we should reform. And I really do believe the Healthy Indiana Plan represents great promise for our people. And I just promise you, as your governor, I'm going to continue to work my heart out to expand access to this proven and successful program, the Healthy Indiana Plan. And you have my pledge. So. And let me just close by saying thank you again. Thank you to everyone represented here in the Indiana Rural Health Association. Thank you for your professionalism. Thank you for, I see friends in the room, people I've known for years. I really do believe that this state is blessed with men and women who work in healthcare at every level. That are there because you're called to be there. You're there because you have a calling to be a healer and a provider of of health care to the people of our state, and it comes through again and again. And I just want to tell you that as your governor, I think the work you do is of immense importance, and whether it be the educational reforms that encourage more Hoosiers to look at healthcare careers, whether it be our push into infant mortality, or whether it be our effort to expand access to consumer-driven healthcare in the state of Indiana. We're doing all of that because we simply believe that with the right framework, with the right information, we can and we will improve the health and well-being of Hoosiers and Hoosier families, especially our children. And I thank you in advance for your ongoing partnership in the health and well-being of the people of Indiana. Thank you, and God bless each one of you and all you do every day for the people of our state. It's an honor to serve you.